My name is Mariano Vazquez. I am CTO, CSO of LM Biotech, the spin-off company of Barcelona Supercomputing Center. There are several strategies that are implemented in worldwide in order to make it cost-effective and efficient in energy consumption, and which can be important for both hospitals and researchers. Each of them, hospitals and researchers, have their own needs. But one of the things that is important is, well, first of all, the different governments are putting into place HPC systems that can be very good for, and well, more than very good, that will be necessary for this for the virtual human twin. So the governments in Europe and in the US, and also in China and Japan, they are putting resources in which you can develop and run the virtual humans. They are putting this not only in the hands of scientists, or not only in the hands of scientists and academia on the public sector, but also on the private sector. They are giving the possibility of companies of using these resources at convenient commercial scenarios. For instance, I give you one example. In Europe, there is something which is called AI factories. These AI factories is a multi-million effort in Europe, in the whole Europe, to help companies, especially SMEs, to develop AI-based tools in many domains, but one of the most important domains is the virtual human domain. And they are doing this so the companies can develop their tools or further develop the tools. This is very important because at the moment of developing, you need massive resources. You need large resources, large computational facilities. So developing, and if you do not develop your tool, then this means that you will not be able to do neither a business of it nor a real impact on the patients. So this specific part, the part of development, is very important. Also, as I said before, commercial cloud providers like AWS are also steering their business model in order to make it more appealing for the different worlds, and especially they are working together with hospitals in order to kind of asking the hospital what are their needs, because we are dealing here with data patients. So in order to deal with data patients, it is very important to have to do it under some requirements. And they are helping the hospitals to achieve these requirements. It is in a very proactive way. It is not just simply putting on the shelf the resources and the hospital can come. No. They are doing this in a very proactive way. So these two examples of initiatives are on one hand governmental actions, and on the other hand, these are private actions. So I think that the combination of these two things are helping a lot to moving forward these virtual human initiatives. The key computational and data infrastructure requirements, if you really want to scale up virtual human to clinical and industrial applications, this is very interesting because these things are already there. So we don't need to, the tools are already mature. Hardware is already very powerful. These tools are properly ported to this hardware. Middleware, which is very important, and it is something that it is many times forgotten. So everything by middleware, I understand everything that is not core software that goes around, but it is decisive. Like for instance, for data protection, all that you do in order to make that the data is safe, all that you do, also all that you do, all the software that you develop in order to make that what you're doing is efficiently running with low energy consumption, all that you do in order to port what you're doing to different infrastructure or to connect different infrastructures. So core software is very important and is already there. Core middleware is already there. Hardware is already there. So everything is already there. So now what is important is not independent components, but what is very important is to connect all of this. And there are some initiatives, especially in Europe, in order to that take this into account, the fact that most of the individual technology is already pretty mature, and now they are working in develop infrastructures. So I think that this is a very important point, and I think that that this is the most important point for software, something that really glue all these things together in an efficient way. Cloud computing is extremely important for the virtual human, um, because it becomes the infrastructure in which you run the simulations, in which you store the data, in which you process the data before running the simulations and after running the simulations by collecting the data. So it's very important, and there are some companies, cloud providers, commercial cloud providers, like for instance AWS, that are very aware of the importance of their infrastructure, and they are changing some parts of their business model in order to make it more appealing for high performance computing applications like this one. That not everything now is an application that runs in your phone and get the information from somewhere else, but these are very computationally demanding applications. So high performance computing cloud is very important and is going to be at the core of the development of this model. I think that commercial cloud providers are realizing more and more, progressively more and more, that there is a business also, and it is a very important part of their business, but also the social impact of what they can do in everything that is related to the virtual human. My key takeaways from the Virtual Human Global Summit in Barcelona are that it was a great conference, especially for many reasons. But one reason I would like to highlight, it is the fact that we cover all the stakeholders in this very important subject, including patient representatives and advocates. So this is something that it is not seen very frequently, because these sort of conferences are in general narrowly minded in the sense that it is a conference for experts. But in this case, there were experts of all fields, but also patients with our not experts in the sense that they know the deep, the underpinnings of the technology, but that they are very deeply involved because they are patients. So that was something that I really loved it. And we after the conference there were relationships that were established between these patient representatives and other experts. And also the patients advocates were really very, very um, interactive, and they put questions that are very pertinent, more than pertinent, questions that are really very decisive and help us to guide our work towards them. So I think that what I would like to highlight is this and the result of this interaction. The result of this interaction is that we can um, I mean, it was something that was done progressively, but it is very impactful when you do this in a conference, in a room full of people, of experts, in which you see that the patient is in front of you, asking directly you. So I think that this was really very, very, very nice, and is something that we as organizers, we are proud of that, and we are very happy with that. Conferences in general are very important because they are very useful to know, so all of us can know what the others are doing, and we can establish a good networking. So in general, this is the good point of conferences, and where you can present your work. But this sort of conference in which they are not, as I said before, they are not they are experts, but confronting with people that are not experts, but they are very influential and they are very, let's say, deeply involved in all. I think that this is very important because it has it has a high impact on the dissemination of what we're doing. It has a very it help us to put our feet on the ground, and to not to, as I always said, I'm a scientist. Publishing is very nice. We are always with the publish or under the publish or perish um, uh, command that is coming from the scientific society. But I think that doing what we do, it is very important to increase the speed of development towards the patient itself. So I think that these conferences are very important for us, for take conscience of that. It is very important for the patients to know what we are doing, and to know that this is very important. It is very important for the politicians that come to the conference, and especially in the dissemination that we can have afterwards, um, because it is a very important subject to be forgotten. It's a very important subject to root this subject in the minds of everyone, in the common mind of society. So that's why I think that where lies the importance of these events.